Let's study about megaloblastic anemia. It's vitamin B12, it's vitamin B12 and folic acid deficiency. The anemias caused by deficiencies of the vitamins B12 and folic acid show identical bone marrow and peripheral blood changes. Both vitamins are essential for DNA synthesis. The two anemias may coexist. In each case, hyperplasia of the marrow occurs, and the precursor erythroid and myeloid cells are large and bizarre. A pancytopenia develops. Vitamin B12 deficiency can occur from inadequate intake in strict vegetarians, faulty absorption from the gastrointestinal tract, absence of intrinsic factor, pernicious anemia, disease involving the ileum or pancreas, which impairs B12 absorption, and gastrectomy. People with pernicious anemia have a higher incidence of gastric cancer than the general public. Folic acid deficiency occurs when intake of folate is deficient or the requirement is increased. People at risk include those who rarely eat uncooked vegetables or fruits, primarily elderly people living alone or people with alcoholism. Alcohol, hemolytic anemia, and pregnancy increase folic acid requirements. Patients with malabsorptive or small bowel disease may not absorb folic acid normally. Clinical manifestations or signs and symptoms of megaloblastic anemia are: symptoms are progressive and may be marked by spontaneous partial remissions and exacerbations. Gradual development of signs of anemia: weakness, listlessness, and pallor. Possible development of a smooth sore, red tongue, and mild diarrhea. Mild diarrhea is seen in pernicious anemia. Possible development of confusion, more often paresthesias in the extremities and difficulty keeping balance, losses, position sense. Lack of neurologic manifestations with folic acid deficiency alone. Vitiligo means patchy loss of skin pigmentation and premature graying hair, often seen in pernicious anemia. Without treatment, patients die, usually from congestive heart failure from anemia. Diagnostic evaluation include Schilling test. Primary diagnostic tool is Schilling test. Complete blood count, serum levels of folate and vitamin B12. Medical management. First of all, vitamin B12 deficiency is recovered. Oral supplementation with vitamins or fortified soy milk for strict vegetarians. Intramuscular injections of vitamin B12 for defective absorption or absence of intrinsic factor. Prevention of recurrence with lifetime vitamin B12 therapy for patient who has had pernicious anemia or non-correctable malabsorption. Now, folic acid deficiency overcome. Intake of a nutritious diet and 1 mg of folic acid daily. Intramuscular folic acid for malabsorption syndromes. Folic acid taken orally as a separate tablet except prenatal vitamins. Folic acid replacement stopped when hemoglobin returns to normal, with the exception of alcoholics who continue replacement as long as alcohol intake is continued. Nursing management. You can see nursing management in previous videos of anemia or audios. Now, assessment in nursing management include assess patients at risk for megaloblastic anemia for clinical manifestation. Example, inspecting the skin, sclera and mucous membranes for jaundice, noting vitiligo or premature graying or smooth red sore tongue. Perform a careful neurologic assessment. Example, note gait and stability. Test position and vibration sense. Let us promote home and community-based care regarding teaching the patients self-care. Assess the need for assistive devices, example canes or walkers, and the need for support and guidance in managing activities of daily living and the home environment. Ensure safety when position sense, coordination and gait are affected. Refer for a physical or occupational therapy as needed. When sensation is altered, instruct patient to avoid excessive heat and cold. Advise patients to prepare bland, soft foods and to eat small amounts frequently. Explain that other nutritional deficiencies such as alcohol induced anemia can induce neurologic problems. Instruct patient in complete urine collections for the chilling test and to enhance the patient's understanding and ability to comply with this collection. Teach patients about the chronicity of their disorder and the necessity for monthly vitamin B12 injections even when the patient has no symptoms. Instruct patient to self-administer their injections when appropriate. Stress the importance of ongoing medical follow-up and screening because gastric atrophy associated with pernicious anemia increases the risk of gastric carcinoma. Thank you. These audios available are only for educational purpose. Please follow hospital policy and doctor's orders while caring with people of anemias and any other disorders.